At least 6% of school-aged children in the UAE may be affected by dyspraxia or developmental coordination disorder. According to medical professionals, there is an urgent need to raise awareness about this learning disability, with parents and teachers alike finding it increasingly difficult to recognise the symptoms among children, leaving a chance that it might go unnoticed. Gopi Krishna speaks to occupational therapists and psychologists to find out more about this lifelong disability.
These children may seem like every other child, but in fact, they are suffering from a lifelong learning disability called dyspraxia, affecting their ability to perform everyday tasks. An occupational therapist working for a reputed clinic in Dubai explains that awareness and understanding is the key to identify symptoms for this disability.
Dyspraxia is this, people think it's a new condition, and people are raising awareness of it now, and it sounds really scary, that hard X, dyspraxia, it sounds really clinical, but essentially all it means is you have a young person, you have a child who has difficulties in the area of motor skills, so coordinated activities that is getting in the way of their day-to-day life. It couldn't be in school and academics. Handwriting is one of the most common reasons people come to me for dyspraxia, but it can affect other aspects like getting dressed, sporting activities, leisure activities, and it's all in that motor area of practice. It used to be called clumsy child syndrome, and it's still one of the other synonyms as developmental coordination disorder. And it was described almost as nice as I've ever heard by an Irish mother when I was way back when I was a student working in this area, who said her son, he was all fingers and thumbs with two left feet, and that's a little bit like this is. The young people, sometimes a red flag could be they have a little bit more cuts and bruises. Maybe the household loses a couple more plates, they spill food a little bit more, because making an accurate motor plan, doing coordinated activities is just that little bit harder for these kids.
So what causes dyspraxia? Occupational therapists claim that it is difficult to offer a clear answer to this question, as children with this disability also have associated difficulties in addition to their motor problems.
Dyspraxia often is seen alongside other issues or other diagnoses. This is what we call, the proper term for it is a comorbidity. So if you have a child who has attentional difficulties, a lot of the time the focus is just getting him to sit still and pay attention, but there may be something else feeding into that. So if you have a child, for example, if you have a young person with ADHD, about 50% of the time they'll also be at a level that would merit the diagnosis of dyspraxia or DCD as well. And the one can feed the other. So if you have a child who has trouble paying attention and you're trying to get them to sit down and write, but as soon as they can sit down, now writings are really tough for them. So if you can give them practical strategies that help here, you can really benefit across the board as well. So although it looks complex and sometimes it can look really kind of a little bit bleak, there is real practical strategies you can do to make everyone, the mom's life, dad's life, the teacher's life, and overall the young person's life, their day-to-day existence much, much, much less stressful.
As dyspraxia persists into adolescence and adulthood, psychologists explain that teenagers with this disability will need the emotional support of their caregivers, as they might feel the pressure of not performing age-appropriate tasks.
A child who has dyspraxia is obviously presenting with issues with motor difficulties, and in the classroom context this can also very significantly impact upon their learning. A lot of the time children are comparing themselves to their peers, and they are looking at their development and they're looking at their progress within the classroom context in comparison to those peers. So sometimes this can be very frustrating for them as well. So again, having a diagnosis and understanding their limitations is very, very important. So there are possible socio, emotional and behavioral difficulties that can come across in children who have these difficulties, especially as they go into the teenage years and when that peer pressure is very rife during that time. So if a child comes to the proper understanding and has the proper support from both the parents, the teachers, and sometimes from mental health professionals as well, this is very important. This will equip the child and empower the child to actually be able to face the difficulties that they're experiencing.
Health professionals suggest that early intervention and a task-oriented approach, along with an active lifestyle, will go a long way in helping a child with this disability. The overall objective, experts say, is not to change the child's motor abilities, but to prevent the onset of secondary academic, social and emotional problems. Gopi Krishna for UAE Weekly.